Dr. Kevin Mangelson with the Center for Sleep Apnea and TMJ. A common question I get asked is, do I have sleep apnea, or am I at risk, or is my family member at risk for having sleep apnea? Experts actually estimate that there is huge numbers of people living with sleep apnea who may not know it. We suspect it's a severely undiagnosed disorder, and that there can be a lot of people out there living with sleep apnea. So let's talk about who might be at risk. For years and years, the traditional sleep apnea patient is categorized as an older male that tended to be overweight and had some sort of cardiovascular diabetes or other comorbidity or other sort of complication going on with their health. What we found in recent years is that has left a good portion of the population that may be living with sleep apnea undiagnosed. What we're finding more now is that lots of people can have sleep apnea. So the things that we're looking for to see if you're at risk or might have sleep apnea are snoring, frequent wakings in the nighttime. If you have a bed partner who's ever reported gasping for breath or frequent wakings in the night where you tend to stop breathing, perhaps your partner has said, hey, you know what, last night there was a time where it didn't feel like you were breathing or you weren't kind of waking up and I was a little nervous for you. If you've ever had a bed partner or someone report some of those symptoms, it would be appropriate for you to be tested for sleep apnea. You can contact your physician, you can contact us at the Center for Sleep Apnea and TMJ so that we can connect you with a board-certified sleep physician to get a sleep test. Sleep apnea is diagnosed with a sleep study or sleep test. Some people may be hesitant to receive a sleep study or a sleep test because they think that they may have to go to a hospital and have somebody kind of watch them and sleep all night there, and they think, I'm not going to sleep if I go to a hospital. Commonly, there are different ways to diagnose that, but one of the common ways is to do a home sleep study where actually you pick up a device that you wear at home, maybe with a couple straps around your chest, something on your wrist, maybe a little nasal cannula, something in your nose, that you might actually even be able to sleep in your own bed. Another way is if you have more complications or if they're more concerned, you may need to do a study in the hospital. Most people who go and do a study in the hospital or a sleep center find that they're able to sleep just fine and get some sort of rest enough that we can diagnose to know if there's some sort of breathing issue or if your oxygen levels are dropping at nighttime. So sleep apnea could be common, and we're looking for some of those key things. Snoring, excessive daytime sleepiness, gasping for breath, frequent wakings. If you or a loved one has any of those symptoms, please contact us at the Center for Sleep Apnea and TMJ so that we can get you connected and get you a test to determine if that might be something that's affecting your health. Thank you.